Morning, everyone. My name is Dr. Eddie Simpson. I'm the President and CEO here at St. Mary's. Welcome. It's our honor to host Governor Hochul, as well as members of Congress, Meeks and Meng. Just indulge me a moment just to tell you a little bit about who St. Mary's is and the kids that we take care of, these special, special children. So we're the place where hospitals and parents come to when their kids have nowhere else to go, where they've been in a hospital and they need ongoing care after they're ready to leave the hospital. And we're the place where they come either to this facility to get care or to get care in their homes. These are children with very complex medical problems. They might need tubes to help them eat, tubes to help them breathe, need a lot of rehabilitative care, true holistic care. That's what St. Mary's is providing to all these kids. Our organization has been here for many, many years, and for all of that time, we've been funded through the Medicaid program in the state of New York. Virtually 95, maybe 98% of our services are provided through Medicaid. And so for us, it's extremely important that we're able to continue to receive those kinds of funds to help provide the terrific care that we provide to all our kids. I really appreciate that you guys are here today, and I'd like to turn the podium over to Governor Hochul.
Well, thank you very much. And I want to thank Dr. Eddie Simpson, the President and CEO of St. Mary's Healthcare. And this is an extraordinary place. You walk in here, it's brightly lit, the sun comes through. It's a place of hope, a place of love, and a place of miracles. And I want to thank you and your dedicated staff of just God's angels on earth, and you have a big fan over there as well, for all the work you do. So thank you, thank you, thank you. Also really proud to be joined by our champions in Congress, Congressman Greg Meeks and Congresswoman Grace Meng, who have been out there on the front lines talking about what devastating cuts, as proposed by the Republicans in Congress, would do all over the state, in their districts, but at a place like St. Mary's. So I just want to thank both of you for being on the front lines, and to the parents and the children. This place is about the children. And I just had a tour a few minutes ago. I met some wonderful children and families, and just, it was really touching. It's hard to see kids that are just in such challenging places because of medically complex conditions. But you know, you see their smiles, and it just warms your soul, and realizes that there's a lot of people who need our help. Yes, darling. And you think about the fact that we have over 7 million New Yorkers rely on Medicaid as a lifeline. Whether it's half of the children, we have 2.5 million kids who get health care, or it's our seniors, our parents, our grandparents who are in nursing homes. Over 600,000 people with disabilities, almost 200,000 pregnant women. These are the people we're talking about when we say, you cannot cut this program, because it is a place like St. Mary's that'll be devastated when they get almost all their dollars from Medicaid. We've over 2,000 children served, 1,200 at home, many, many here every single day, who are getting life-saving support and care. And if they dare touch this, there has to be a revolt from all Americans, but certainly here in the state of New York. We'll take that fight on. And I think every Republican member of Congress who claims to represent New York State should come to St. Mary's, look in the eyes of these kids, listen to their voices, talk to the parents, and then still see if you can go back to Washington and cut this program. I bet you cannot, because otherwise you'd be the most heartless, callous people who ever walked this earth. I challenge you. Come here and tell them you're willing to cut them, this lifeline. But here in New York, we're here for the families. We'll continue supporting them. And when all the parents here, and I talked to the CEO here about what people are feeling when they heard about the cuts in Washington, these families have enough stress in their lives. They're dealing with complex situations, life and death situations. And now they have to worry about whether their health care for their kids is going to be covered. We're better than that. New York is better than that. America is better than that. And we won't let that happen. And I will say as an aside, this is not the only program that's under assault by Washington. Not just Medicare, but Elon Musk representing the Trump administration, just called Social Security, which has been in place since the Depression, conceived by Franklin Roosevelt, who once held the job I held now. Social Security is a lifeline for people with disabilities and seniors and everybody who works hard to count on their files. He called it a Ponzi scheme. My God, we have to stand up and say, you are not unraveling the social fabric of our nation, because we take care of our people. So this is the fight we're waging, my friends. I'm ready for it. I'm up for it. And I know we have great partners in government who are going to take it to the mat, and we're there with you all the way to the end. Let me introduce Congressman Greg Meeks, a tremendous, tremendous champion, not for his district, but for this entire country. Congressman Meeks.
First, we're lucky in New York. The reason why we're lucky in New York because we got Governor Hochul as our governor, who we know will stand up and fight and work with us as we deal with this crisis that we have to deal with currently in Washington, D.C. And I'm happy to be here with my colleague, Grace Meng. We work very closely with Congressman Tom Suozzi, and we know this is his district. And we in New York, along with the leader of the Democratic Party, Hakeem Jeffries, we are walking hand in hand, locked together to defeat those that want to take away money from Medicaid, our seniors, our children. 215 Democrats came to the floor, some just giving birth, some having an IV hooked to them to come to the floor to vote to make sure that we don't take over $800 billion and put it someplace else to give a tax cut to some of Donald Trump's friends. That's not who we are. That's not who we should be. And I don't believe that's who the American people is. We're not going to stand by and watch these cuts being made. Interesting to hear, because we have a number, as the governor indicated, a number of individuals who are Republicans. This should not be a Democrat and Republican fight. It should be a fight that's about all of us, about human beings. The work, Mr. CEO, that you're doing here at St. Mary's and all of the employees here, it just warmed my heart to see the care and the love that the employees were giving to these young people. It is what this is about, and that's who we are as Americans. So thank you, every employee here at St. Mary's. Thank you for what you do on an everyday basis to try to make sure that these children have better lives. And to the parents, thank you. And we're going to stand by you, because we know the work that is being done at this hospital and the funding that comes with Medicaid to make sure that they have an opportunity to even have treatment at home, to get home. That's what this is all about. So it's about keeping families together. So we're not going to allow House Republicans who betrayed hardworking American taxpayers by voting to cut Medicaid. We're not going to allow Donald Trump to continue to push a budget that betrays who we are as Americans. This would be the largest Medicaid cut in American history. Now, I know when we could all go by our districts. Here, I could just say in the 5th Congressional District, for example, over 312,000 people would be directly affected. 312,000. And when you add it all up, as the governor has talked about, over 7 million people. So it's time for all of us to stand up and say, as the camera of history is rolling, because that's what is happening right now. The camera is rolling, and the question is, what did we do at a time when individuals were trying to do a reverse Robin Hood, taking from the poor, taking from the middle class to give to the super rich? We coming together will make the difference, and that voice will show the values of who we are as Americans. The world is looking at us right now, and they're asking that question. I know that the American people did not intend to see what we're seeing now. Cost of food, inflation still going up. Our allies are being treated as our adversaries. Our adversaries are being treated as our allies. That is the wrong direction. I can tell you, we will stand with our governor in the House of Representatives, the members of the Senate, working hard on behalf of the people, all people, in the great state of New York and in these United States of America. It is now my distinct honor, privilege, and pleasure to introduce one of the hardest working members of the United States Congress that I know, who I admire so much, the Honorable Grace Meng.
Thank you so much to Congressman Meeks for your leadership, and thank you so much, Governor Hochul, for once again coming to Queens and for prioritizing the needs of families here in Queens and throughout the entire state. Thank you for inviting me and including me and all of us today as we shine a light on the impact that reductions to Medicaid funds would have here in New York. And of course, thank you so much to the leadership of St. Mary's, to the staff, to the volunteers, and to the families, and especially to our children. They are really on cue. It's like you practice this with them. So much of what we have seen coming out of Washington in the past few weeks have really been troubling. And that includes the push to make draconian cuts to Medicaid. Putting Medicaid funding on the chopping block would be catastrophic for the health and well-being of New Yorkers. The Republicans' efforts would literally force low-income, sick, and elderly Americans to pay for tax breaks that would only help the richest people in our country. I've heard incessantly from constituents here in Queens who've told me that slashing their Medicaid benefits would devastate them and their families. One woman, for example, said she would not be able to afford doctor's appointments, prescriptions, wellness exams, like mammograms and more. Stories like these are unacceptable. It endangers people's lives. In my district, almost 2 out of 5 of my constituents are enrolled in Medicaid. It's a lifeline for so many in New York State. We cannot let our kids, young adults, seniors, families, those with disabilities, and vulnerable New Yorkers go without the health care that they require. This is especially true for those with medically complex diagnoses that require long-term and specialized treatment, such as our patients here at St. Mary's, a place that is there to serve people from all throughout the state of New York. I'm also concerned about the effect on individuals whose elderly parents and families rely on Medicaid for nursing home services. We should be expanding access to care for families, not seeking to decrease it. It is good to take a closer look at where we can root out waste, inefficiency in our government. But it is cowardly to do so by just tweeting on X or voting irresponsibly from all the way in Washington. People like Elon Musk and the administration and colleagues who vote for Medicaid cuts should come to places like St. Mary's and say it directly to the children and to the families who would bear the brunt of these cuts. Thank you again to our Governor Hochul for leading with such compassion and for inviting me to join you today. I stand with you in opposing deep cuts to Medicaid for our state and will do all that I can to fight against it so that those I represent and New Yorkers all across our state are not stripped of the crucial coverage that they depend on. And you don't have to just listen to us. Hear it directly from the families. Next, we have Elizabeth Gunny, whose child's name is Abigail, to come speak. Thank you, Elizabeth.
Thank you very much. Thank you so much, Governor Hochul. Thank you for coming here. Thank you for your compassion. Thank you for helping our children be seen. Thank you so much, Congresswoman Meng, Congressman Meeks. Thank you for all the work you're doing for us. My daughter's Abigail Puplampu, and she has trisomy 18. It is a diagnosis that is prevalent in 1 in 2,000 live births. When she was discharged from the NICU home, she left in an ambulance because she was not stable enough to go home. She left not because all was well, but because she was going home to have time with her family before she passed. My daughter Abigail is 4 years old now. Thanks to access to home care through Medicaid, she gets access to home care, home nursing, thanks to the great casework that St. Mary's does for us. She gets access to therapy. We are so grateful that because of access to home care, that we got a chance to live our dream with her. We're so grateful that her 11-year-old brother says the G-tube is the most important invention of the 20th century because his sister depends on it to live. Thanks to Medicaid, we get to enjoy that. He gets to understand the need for that. Cuts to Medicaid will be devastating for us. Thank you for fighting for us. Thank you so much for championing all of our children. We really need the help. Thanks.
Thank you, Elizabeth. And boy, if that doesn't touch your heart, you were doing it for all the little Abigails of the world and the children here today. And I'll be happy to take a few on-topic questions at this time.
On topic on healthcare? You want to ask a question about homework?
No, as far as you know, it was definitely going to be about being homeless.
No, we got to go on topic. Thank you.
All right. Thank you, everyone. Appreciate you coming. I appreciate everybody. Thank you so much.
I was thinking I get that question a lot when I visit the
Can a congressional act do that? I'm not sure, but yeah.
I mean, hey, maybe it could be executive order.
Yeah, that would be fabulous. So much as well.
She's so close now. This girl is half his age. Don't stand so close to me. Don't stand so close to me. Her friends are so jealous. You know how bad girls get. Sometimes it's not so easy to be the teacher's pet. Temptation, frustration.
The heart is a balloon, shoots up through the stony ground. There's no room, no space to rent in this town. You're out of luck, and the reason that you had to care, the traffic is stuck, and you're not moving anywhere. You thought you found a friend to take you out of this place, someone you could lend a hand in return for grace. It's a beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away on the road. But you've got no destination. You're in the mud, in the maze of her imagination.
You know, as I've said before, anyone who wants to run for any office certainly is able to do so, but my focus right now is not politics. It is on the fact that Republicans in Congress have proposed devastating cuts that'll harm people all over America, but especially right here in Queens at St. Mary's Healthcare, where we have children with very challenging health circumstances and their families are struggling. And for them to think that they could lose Medicaid is another level of stress they do not need. So that is my primary focus right now.
Great.
All right,
Thanks,
thank you.
everybody. Happy Sunday.
Thank you.
It was a beautiful